Okay, this is over chapter 25, objective 2, which is going to be the anatomy of the kidneys. So I can remember what chapter it is. So chapter 25, objective 2, anatomy of the kidneys. So you're going to learn a lot about this in the lab portion of the class for sure. The nephron is the main functional unit of the kidney, and you can see it in yellow here, how it starts in the cortex, which is this area out here, and then dips into the medulla. And this is where the blood and the urine get filtered. Blood gets filtered. A lot of filtration happens up here as well, but there's also blood filtration that's happening throughout the entire length of that nephron. Once urine gets made, it's going to get dumped in the from the collecting duct and then out into the ureter to go outside the body. So I suggest y'all take a look at this YouTube video. What this does is it stretches the nephron out so you can really see all of the different parts. So the renal corpuscle here, which is consisting of the glomerular capsule represented in blue and the glomerulus represented in red. Now the glomerulus is actually a bunch of capillaries. So you have dirty blood, if you want to think about it that way, going into the afferent arteriole. It's going to get filtered, and the waste is going to exit the glomerulus. Okay, that we don't want, what we don't want. And then the clean blood is going to leave the efferent arteriole. Remember, afferent is bringing it towards, efferent is taking it away. Now that waste is going to enter into this first section called the proximal convoluted tubule, proximal because it's closest to the renal corpuscle, convoluted because it's all kind of twisted and crooked there. Then from there, it's going to go into the descending limb of the loop of Henle, come around and enter the ascending limb of the loop of Henle, where it's then going to enter into the distal convoluted tubule. Distal because it's further away from the glomerular capsule or the renal corpuscle as the urine is traveling, right? Convoluted because it's all twisted. And then that will dump into the collecting duct, which will again empty into the ureter, going to the bladder and out the body. So the nephron here is the main functional unit of the kidney. So general kidney makeup, you've got about 2 to 3 million capillaries called these glomeruli. That's where the filtration occurs, that are located between the two kidneys, and their job is to filter the blood, get the waste out. So here's a glomerulus here. You can see the red. Again, this is kind of reversed from the picture we just saw. You have your afferent arteriole bringing blood in, efferent taking blood out, and all of this in here is that capillary network that's representing the glomerulus, and then the waste is coming out. Bowman's capsule surrounds that glomerulus. So in yellow here, you have Bowman's capsule, which surrounds the glomerulus. This entire structure is called the renal corpuscle. Glomeruli filter blood based on particle size. That's it. It's just, is it too big to go through? No, it stays in the blood. Is it small enough? Then it'll pass into the filtrate, into the waste. So large elements such as blood, platelets, antibodies, they're too big to pass through the capillary, through that glomerulus, which is, a capillary, too big to pass through those walls. So they stay in the blood. Small elements, ions, amino acids, vitamins, wastes, they're filtered out to create something which is similar to plasma, but it's called filtrate, and that's going to enter into that nephron. And you're like, wait a minute, don't we need to keep vitamins and amino acids and things like that? You're right. So what the kidney does is it filters through the filtrate, picking out what we want and putting it back in blood, and keeping what we don't want in the that will go out the body in the form of urine. So the glomeruli create about 200 liters of this filtrate a day, but you only excrete 2 liters of urine. So what happens to that 198 liters? It gets sent back into the bloodstream. Okay, so you're only 2 liters of that ends up being as true waste. So 200 liters in, 2 liters out of the body. That's objective 2.